Hey guys, so I'm making this video about oral minoxidil because I've seen I have the problem of androgenic alopecia, right? My hair falls. It's very thin. It's kind of a bad hair. My father is completely bald, and before my hair falls out, I'm looking for solutions. And I think I found a solution with the Finasteride, I'm not going to say that it's 100% no side effects, no problem. I'm taking a bit of a risk, a bit of a risk, but it's calculated risk. A lot of people have been using this stuff for decades now. I've talked to multiple doctors. Everyone says that that's very prescribed and there's not much problem. Now, if I was a dumbass, I was a dum-dum, I would go to the internet to search for advice on forums. And that's the last thing you need to do, because you need to understand that advice from the internet is really crap. The internet is filled with really stupid people, really dumb people. And you don't want to get advice from them, if in anything. If you want to, for example, let's say, look up advice to build muscle, you go to YouTube. How do I do this exercise, for the shoulders, for example? Then you go and you see a bunch of videos, and I guarantee you 90% of these videos will show an exercise that if you do it long term, you'll fuck up your back, you'll fuck up your shoulders, you'll get fucking chronic pain on your fucking back, herniated discs, your ligaments of your shoulders will be completely fucked. So you don't want to take advice from random people online, especially like from forums. At least YouTube, the people have a lot of followers. I mean, there's people with a lot of followers. Like Dr. Berg, for example. He's a complete idiot, but people defend him to the death. People will defend their scammer to the death. With medication for hair, this is very prevalent, and if you go to hair loss forums and stuff, there's a lot of people saying that minoxidil is crap. They didn't want to take because it castrates you or whatever, and they use that word, castrate, because it makes you think of cutting your balls off, and that's very gruesome idea. So they use that word, and no, it cuts DHT. It prevents testosterone to be converted to DHT for 7 hours, and then about 7 hours, and then after those 7 hours, testosterone continues to convert to DHT, but that the Finasteride sort of accumulates on your skin, and it doesn't allow for that DHT to fuck up your hair follicles, essentially like that, It accumulates on your skin. It's not like it blocks your DHT 24 hours on a day. It blocks your DHT for about 7 hours. But I'm not saying that's why it doesn't have side effects. It has side effects. This fucking drug obviously has side effects. Obviously, if you're messing with your system, there will probably be side effects. That's why it works. If it doesn't have side effects, problem doesn't work, especially with something like this, like hair loss, testosterone, for example, from decreased testosterone. It needs to have the side effects. So I'm taking a risk. But it's calculated. I've talked to about a bunch of doctors. Everyone says it's prescribed very often. A lot of people take it. People have been taking for dozens of years, decades, and there's no significant side effects for people. There's a minuscule percentage that say that it pretty much ruined their life. I don't know if this is true. I don't care. I'm not. I'm taking the chance. I'm not that much of a pussy. That a 0.1% is gonna like. There's probably a higher chance that I'll get depressed. I get suicidal from losing my damn hair, and that will probably affect my life more than a 0.1% chance that this gives me depression or something. So the actual side effects that have a substantial percentage of people of finasteride is like 1% of people get sexual side effects, and I've been experiencing that a bit, but I will continue to take. It's not like completely. I just my libido went down a bit, not completely down, but a bit. I noticed a little bit down. I will continue to take it and see if it goes back to normal. I think it has been going back to normal, but I'll see if it goes back to normal. If it doesn't, I'll cut the dosage. I'm guessing it probably go back to normal. It's probably my testosterone being converted, my extra testosterone being converted to estrogen, because this increases, finasteride increases testosterone a little bit, and that extra estrogen from that extra testosterone might be screwing up my system a bit. But I'll see if it goes away on its own. And I've been taking for about like 3 months. If not, I'll just reduce my dosage. It's no problem. I can take like 1 milligram for 3 times a week, and it probably already works. People have been taking like a really small amount and it works. But now, about Minoxidil, I have experimented with topical Minoxidil. I will probably stop it because it makes my head itch and it's a pain in the ass to use, and it doesn't really stop balding. It just strengthens your hair. While that's cool and all, I don't really care. As long as I'm not bald, as long as I'm not losing hair with finasteride, I don't care if my hair is a bit thin or not. I don't really care about that. I really just want to keep my hair, and it's not that thin anyway, so I was just taking Minoxidil pretty much because I was scaremonged into not using finasteride at first, but then I looked at it better and decided, screw it, I'll use it. And I remember my first dermatologist that advised me on finasteride. She was terrible. She was a terrible dermatologist, and cited side effects that it didn't happen with finasteride, like heart problems. And heart problems is a very big scare to me. So I'm like, finasteride causes heart problems. I'm not taking it. But then I found out no, there's literally nothing about that, about heart problems. It's mainly just libido and depression and stuff, even though that's a very small percentage. So yeah, I took a chance. It is what it is. So, oral finasteride. And this video I'm going to talk about oral finasteride. Oral finasteride, it's like an alternative to topical finasteride. However, it is not prescribed for hair loss. You cannot buy it without a prescription, and it is for blood. Why has it not been ever made for hair loss? Well, because it kills you. In long term, it can cause pericardial effusion. It's like this sort of stuff, the outer layer of your heart starts accumulating blood and it kills you. And this Minoxidil here causes that, and it causes also like an increase in heart rates. A small increase in the average of your heart rates. So that's you don't want that. Everything like the heart, you don't mess with your heart. If your heart stops working, you die. It's not like something that you can go back from, let's say if I ruin my hormones, I can hop up on TRT. Let's say I fuck up a kidney, I can get a transplant. If my heart stops working, I die. So yeah, this causes heart problems, and it's not prescribed for hair loss. And even people that take this for blood pressure usually take other stuff with less side effects. But a lot of people are on the forum saying to take this. People take it. And I found this video recently. It was recommended on my home here. About this individual here. I started on Minoxidil for hair growth. And why did he fall for this trap? Because he listened to people online. Do not listen to people online. If you like, for example, you go here and you listen to this guy, then you're like, okay, this might be an option. Then you go to your doctor. Don't go to a dermatologist. Go to your family doctor, for example, and say, look, can you look up this medication? Is this okay to take? And it says yes. Then go to a dermatologist and ask for her to give you the paper, so you can get it. So don't be like a dumbass and buy it on the black market or something, and ignore every warning, and take it because people on the internet are saying good stuff about it. That's dumb. So, like I've been saying, this causes pericardial effusion, which fucks up your heart, and increases the BPM, your heart rate, your average heart rate, which is bad. You don't want that. And this guy starts off the video saying, "Yeah, I've been taking it, and I've been feeling a problem in my chest. Like I just work, and then I have a sharp sensation on my chest. Whoa, that's so strange. Really strange. Look at this face. That's really strange. Really odd. People didn't say this on the forums." So when you go on the comments and you see other people, "I had issue with chest discomfort while using this drug. I also experienced, what do you mean? Stop taking it, it feels for a year or plus later. Not worth my opinion." So this guy doesn't say he had pericarditis. He just says, "Oh, I had chest discomfort," which suggests that he didn't find out the reason for his chest discomfort. Neither did this guy, and you'll probably find other people saying that the heart pain in chest could be because higher dosage, as you mentioned. Look at this retard here. It could be because of higher dosage. Duh. He doesn't know if it's because if it's even dose dependent. It could be. I don't know. Let's try another one. It's like talking to retards here. They didn't experience some chest tightness, and this stuff could be also a placebo. Take that in mind, because no one ever thinks what they experience is placebo. No one ever. When I was searching for a topical minoxidil, a lot of people on the comments section were saying it gave them heart palpitations. Then I started using it, and it didn't give me that. And then I found out heart palpitations is very uncommon, very low percentage. However, the entire comment session was about it. And why? Because heart palpitations is a very something very common with placebos. Everyone has heart palpitations, just don't notice it. If people are saying you're going to have heart palpitations if you do this, Then you start noticing it. Then you say, okay, I have heart palpitation, because you're noticing it. Everyone has it. Everyone has some heart palpitations. Normal. So it could be that, or maybe it's not. Maybe it's not. Heart pain. You don't know. It's just chest pain. A lot of people saying they had some chest pain. Yeah, do the chest pain is 100% natural. Some cardiovascular have. I think you have to be extremely cautious with this medication. But not taking more 2 milligrams, though ideally can maintain the hair. That's there you go. We don't know if the side effects are dose dependent. Why do you just like, oh, if I just take less of it, maybe there's less side effects? You don't know that. You don't know that. Like 100 milligrams of something can kill you. A milligram of that can also kill you. Even less of that can kill you. You don't know if it's dose dependent. Why are you saying that it's probably dose dependent? You don't know. Are you going to like say, oh, it's probably, and risk it? Why? It's really not a good idea. Yeah? Had a simple chest pain, so I stopped. Now, everyone that's had chest pain, do you know if it's permanent? If you make permanent damage, you don't know now. Now you have to live with that. Did it make permanent damage? Now you have to live with that. Now, like I said, this can be placebo, psychological. Can be perfectly that. But since it has been shown to happen, I wouldn't risk it. So that is all. Don't take oral minoxidil. Don't be a dumbass.